and hygiene. Hello, my name is Jenna. I'm the student nurse today. I'm going to be doing a head to toe assessment. Should only take about 10 to 15 minutes. What I'm going to do is just assess you head to toe to make sure everything's functioning properly. So thank you for allowing me to do this test, or this assessment, excuse me. I'm going to start with patient's posture is sitting upright. Their mood seems content. I'm going to look at hygiene. I see that patient is well groomed and no foul odor. I see that there are no lines, tubes, or drains present. And then could you rate your pain on a scale of 0 to 10 for me?
0.
Awesome. And what brought you in here today?
Just a regular checkup.
Perfect. And then what's the day?
Thursday.
And the year?
2025.
And then the president?
Donald Trump.
Awesome. Patient is conscious and oriented ×3. And could I have you smile for me? I see that patient's smile is sitting symmetrically on the face and that their speech is clear and intact. I'm going to first start with a grip test. Could you just squeeze my 2 fingers as hard as you can? Right, grip is strong and symmetrical on both sides. And I'm going to go ahead and do a strength test. So I just want you to put your hands here and I want you to pull. I'm sorry, push. And then put your hands here and then pull. And then the same with the feet. Press down, and then press up against my resistance. Alright, I see that strength is a 5 out of 5 on upper and lower extremities. I'm going to go ahead and do a sensorium test. It's just going to be me asking you if this is sharp or dull. So this is sharp, and this is dull. And I'm going to do it on your arms and legs, so if you could just close your eyes for me.
Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Awesome. Alrighty. Now I'm going to go ahead and start with your head. So I'm just going to look at your scalp. I see that it is dry and intact with no lesions or moisture. I see that the hair growth is evenly distributed on the head, that the head is sitting normocephalic. I see that the eyebrow and eyelash hair is evenly distributed. I'm going to go ahead and look at your eyes. Could I pull down your eyelids for just a second? I see that sclera is white, the conjunctiva is pink, and the cornea is clear of drainage. I'm going to go ahead and start with an eye assessment. I'm just going to shine this light in your eyes. I just want you to look at me. Right. Pupils are round and reactive to light. I say the pupil size is about a 2. And then could you just follow the pen light for me with just your eyes? Right, accommodation is intact. I'm going to go ahead and start by assessing your ears. I'm just looking for any lesions or drainage. I'm not seeing any. I see that the ears are sitting symmetrical on the face. I see that the skin is clear. And I'm just going to go ahead and shine this light in your nose. I see no nasal flaring or drainage. And then can I have you stick out your tongue for me and open your mouth? My tongue is sitting midline. I don't see any drainage or lesions, and the hygiene, oral hygiene is good. And do you wear any hearing aids or visual contacts?
No.
Awesome. All right, I'm going to go ahead and start by listening to your heart sounds, and you can just breathe normally for me.
Okay.
Start with the aortic, pulmonic, herbs, tricuspid, the mitral, and the P9. So, heart sounds have a regular rate and rhythm and are strong. I'm going to go ahead and just listen to your carotid arteries. I hear no bruise present with the carotid arteries, and I do not hear any murmurs present with the heart. I'm going to go ahead and just check your pulses on your wrist for me. Do the brachial. I feel the rate and rhythm is regular with about a 2+. Then I'm just going to check pedal pulses. And can I take your socks off?
Yeah.
pedal pulses are also symmetrical on both sides with a regular rate and rhythm. I'm going to go ahead and palpate the carotid arteries, as well as a regular rate and rhythm and symmetrical on both sides. And then I'm just going to check for cap refill. I'm just going to press on your fingertips for me, and I'm going to do your toes as well. Alright, cap refill, less than 3 seconds on the upper extremities, now the toes. Alright, less than 3 seconds on the toes as well. I'm going to go ahead and start with your lungs. So can I just have you take a deep breath in and out for me? Right, and then again. I see that chest wall rises and expands symmetrically on the anterior and posterior side. I'm just going to start with listening to your lungs, and I just want you to take a deep breath in and out every time I move the stethoscope. Sorry, I'm actually going to start up here. Awesome. I hear that breathing is even and unlabored. I'm just going to hear the middle low for you. Awesome. And then can I have you turn to the back for me? You can go ahead and turn back around for me. I hear the workup breathing pattern is even and unlabored, symmetrical on both sides with a regular rate and rhythm. Now, have you had any cough or like sputum recently?
No.
Awesome. All right, I'm going to go ahead and have you lie down for me. I'm going to check your abdomen. And when was your last bowel movement?
This morning,
And then your last void?
probably 2 hours ago.
Okay. And I'm just going to start with listening to your bowel sounds. You can just breathe normally while I do this. I'm also going to note that the patient's shape and contour is flat with the abdomen. Alright, I hear that bowel sounds are present in all 4 quadrants and are normal active. Now I'm going to go ahead and press on the same 4 spots. Please let me know if there's any pain or tenderness.
No.
Awesome, and you can go ahead and sit up for me. Next, we're going to be just doing a range of motion test. Please let me know if there's any pain while doing this in the joints or anything like that, and if we need to stop. So I'm just going to have you first start with shrugging your shoulders up and down, and then looking left and right. Awesome. Any pain there?
No.
All right, and then can you go ahead and roll your shoulders for me? And same with your wrists and your arms. I'm not hearing any crepitus. And I'm going to go ahead and have you stand up for me. I'm going to check the spine, so I just want you to bend down and touch your toes. See that spine is sitting midline and symmetrical. And can I have you do a squat for me? Alright, any pain there?
No.
Alright, I'm not hearing any crepitus. You can go ahead and sit down. I'm going to check the ankles. Could I have you roll your ankles for me?
Yeah.
Any pain with that? Alright, and so no crepitus was found. All range of motion was perfect. I'm going to go ahead and have you stand up and we're going to assess your gait. I just want you to walk to the door. You see that gait is symmetrical. Awesome. I'm gonna have you sit down. We're on our last little leg here. I'm just gonna assess your skin fully. So I'm gonna start with skin temperature. Sorry, I'm just gonna move this. And I have your arms put up. Thank you. Skin temperature is warm on the upper extremities, as well as the lower extremities. I'm going to look for any scars or wounds or lesions. I'm not seeing any. I'm going to check for skin turgor. Alright, I see there's no tinting present. And I'm going to go ahead and check for edema, so I'm just going to press on all extremities. And I'm not seeing any moisture or lesions throughout, and no edema is present. And I see that the patient's skin color is to their configure, white and olive. And that is it. Thank you so much for doing this assessment.